Welcome to the Fit for Halter podcast. We're here to bring practical content and community to the amateur halter exhibitor. I'm your host, Amy Zabel, and I interview people from across the halter horse industry. We'll learn new techniques, hear about the hottest products, and get to know one another. If you grow in your knowledge and we gain more exhibitors in the ring, this has been a success. It's a laid-back environment. Prepare to be inspired and maybe take some notes. Welcome to the Fit for Halter podcast. We have another timely episode in store for you. As we near the futurity season, it's important to consider your preventative health plan for showing and trailering. Some of you will travel from show to show with long hours on the road and weeks spent away from home. So in this episode, Gary will take a look at preventative measures for common respiratory and gastrointestinal illnesses we often see in the midst of the show season. Gary, welcome to the Fit for Halter podcast.
Thank you very much, Amy. I'm excited to be here.
Thank you for investing in us. So you attended vet school at UC Davis and completed an internship in large animal medicine and surgery at Texas A&M. After completing 3 residencies at UC Davis in internal medicine, emergency and critical care medicine, and clinical pharmacology, you're currently a professor and clinician at the School of Veterinary Medicine at UC Davis. Quite a history and just a repertoire of education that's now being poured into us in this episode. So thanks so much. Along with being a vet, you're a halter horse owner and exhibitor. Can you tell us how you got started in the halter industry and an overview of your current show horses?
Yeah, thank you. How I got involved with halter horses was back as a kid. I grew up in a suburb of LA, and there was a small boarding stable there along a creek, and I bugged my parents until they let me, hang out there and ride there, and they made the mistake of getting me my first horse as a kid, and then that led to all of this. And as a kid, it just happened that at that barn there were quite a few people that were into halter horses, different breeds of horses. And I had a little grade quarter horse mare, and my friends bugged me until I agreed to try to show her. And she actually beat all of their horses at the open show.
Love it.
And so that was the first step in triggering a passion for it. And so I did that as a youth, mostly in open shows. And then I got my first registered American paint horse and showed her a little bit at the local APHA shows in California. And then I went to college and vet school, didn't show for a while. But all the while, I have maintained a really strong passion for halter horses. And those of the audience members that know me know that I'm a fanatic about pedigrees and genetics, and I kind of combine my love of genetics in evaluating halter horse pedigrees. And so I've been mostly on the sidelines in the recent past, but I was fortunate enough to get back in and got a stud colt 3 years ago. And he's now a 3-year-old colt, and he's with Jeffrey Pate. And we're hoping, if everything goes well, that he'll be at the World Show this fall. And that'll be a lifelong dream come true for me, just to have a horse show there.
That's awesome. So many of us have gotten our start at open shows and just progress from there. So a lot to be said for the open show world in helping kids get going.
Absolutely.
So one of the topics that we wanted to cover in this episode was respiratory illnesses. I appreciate your investment in us in this particular time of year as people are really pushing or maybe haven't started yet, but they're getting ready to head down the road for long distances. What are some of the most common respiratory illnesses that you see affecting horses?
Yeah, that's a great question. And I think, one of the biggest problems exhibitors, trainers, amateurs have at the fall shows, and really this applies to anybody showing weanlings and yearlings, is respiratory illness and trying to keep the babies healthy through the show season. And so, I hope this will help in that regard and to try and keep the foals and yearlings as healthy as possible. So, what are some of the common respiratory diseases? And those are most commonly they're viral respiratory diseases. So the common ones are influenza. That's one of the most pathogenic viruses, and by that I mean it makes the young horses quite ill. And then herpes viruses. So those will be known. Many of your audience members may know those as rhino. That's one of the common terms that applies to that group of viruses. And there are two in that group, herpes 1 and herpes 4. And many people have heard about herpes 1 in that it can cause really severe neurologic disease, especially in older horses. Well, in young horses, it can actually cause respiratory disease. And then equine herpes 4 is another form of rhinopneumonitis, or abbreviated as rhino. And then a couple others are rhinitis A and B. And these are milder illnesses caused by the rhinitis viruses. And they're kind of analogous to a cold virus for humans. But in babies, they can certainly make them quite sick. So those are the most common ones. And then on the bacterial side, the most pathogenic one would be strangles, and that's a bacterium called Streptococcus equi. That's the scientific name. And then there are a whole host of other bacteria that can come in and cause pneumonia after the viruses come in. So typically, the foals or yearlings, young horses will get a viral infection like influenza or flu, like herpes virus or rhino, and then that'll depress the foal's immune system or the young horse's immune system, and that'll allow bacteria to overgrow and get down into the lungs, and then they can get pneumonia, which is even more serious. And so, we'd like to prevent those viral infections to begin with so that the foals are less likely to get pneumonia, if that makes sense.
Okay. You touched on the babies a little bit. Do you see different illnesses or scenarios playing out in the babies versus adult horses?
Yeah, that's a great question. Definitely weanlings and then yearlings are at greatest susceptibility for the viruses that we just talked about. Certainly any age horse can get them, but the younger they are, the more severe it tends to be. And so they're much higher risk. A young foal is analogous to an infant where they have not been exposed to a lot of pathogens and their immune system is not primed to fight against these. So they tend to get more severe illness than, let's say, an adult horse. So in an outbreak situation, all ages might get the virus, but the weanlings are going to be most severely affected in general, and then yearlings would be next, and so on.
Gotcha. What are some of the early signs and symptoms that we should be looking for?
Yeah, another great question. So some of the early signs would be fever, and that often can be missed with some of these viruses. Sometimes the foals will just look a little quiet or maybe not eat as well. And some of the viruses, like herpes viruses, can have a biphasic fever. By that, I mean they'll have an early fever, and that might be missed entirely. And then the temperature normalizes for a few days, and then they'll have a second wave of fevers, and then the illness starts. So catching the illness early would be through monitoring body temperature. That's one of the preventative means, is to keep an eye on the show horses' temperatures while they're at the show so that you can catch these early. because the signs can be pretty non early on. Once the disease gets going, gets established, then the clinical signs include cough, nasal discharge, and oftentimes that's mucoid, kind of like a person with a cold. It's kind of a sticky, starts out clear, and then it'll progress to white. And then when they start getting those secondary bacteria that I was talking about, a lot of times it'll start turning yellow or greenish. And then, yeah, so cough, nasal discharge, and fever, those are the most common signs. And then as it progresses, and especially if they develop secondary bacterial pneumonias, then you'll start seeing lower respiratory signs, things like rapid respiratory rate or a lot of respiratory effort, foals breathing with their abdomen. Will be a sign of pneumonia. So you'd like to catch it at the fever stage, even before they have a cough or a snotty nose or mucoid nasal discharge.
Super helpful. Just had a session with Jason Smith, who mentioned taking temperature of the babies multiple times. And I didn't really ask further about that, but now it makes perfect sense to stay on top of and kind of get ahead of the progression. So in thinking about prevention, what are some of the best practices for preventing respiratory illnesses in horses?
Yeah, good question. It's a complicated question, and it includes a lot of different factors. So the first one is to start out with a healthy foal in general. So that means good nutrition, making sure they're getting all the vitamins, trace minerals that they need, because those are important for the immune system in particular, making sure they're getting adequate copper, zinc, iron, as well as vitamins, vitamin A, E, C, and so on. So start with a baseline of good nutrition. Then another part of the prevention is vaccination program. And that one is not necessarily a one size fits all. It's going to be something that your audience members want to work with their veterinarians to get a vaccine protocol that's tailored to their program and their location and their goals. I can give you some general recommendations. We can come to that, but having a good vaccine protocol in place, because there are vaccines for influenza or flu and for rhino or herpes virus. And in some instances, we might recommend strangles, not routinely, but in some specific situations. So vaccines are part of this. And then deworming is another really part of trying to prevent respiratory illness, because interestingly, the parasite that we're most concerned about in young horses is the roundworm of horses. That's Parascaris. And that worm has a liver-lung migration when it's a larva. In other words, when the foals or young horses first encounter the ova or eggs from their environment, they're shed by the feces of other horses. Well, if they're picking these eggs up, they hatch in the intestine, and then they have to complete a cycle before they become adults and can make their own eggs. And part of that life cycle is to migrate through the liver and then the lungs. And as they're migrating through the lungs, that causes inflammation. And that inflammation is a great environment for bacteria to set up. And so we'll see young horses, you've probably seen some of those, that have a snotty nose and cough, and you treat them with antibiotics and they get better, and then you take them off, and a week or two later it comes back and they get the snotty nose and cough again, and then you treat them again and it goes away, and then it comes back again. Well, some of those have parasite migration through the lungs as the underlying predisposing risk factor. So you want to make sure that you have a good parasite program and that young foals are dewormed specifically against roundworms. And nowadays there's increasing resistance among parasites because the dewormers have been around so long that now we're seeing parasites that develop resistance. So roundworms are one of those. And so you want to make sure that the dewormer that you're using is effective against roundworms. And in general, those are the class of dewormers called benzimidazoles. And some examples of those would be fenbendazole. Some of the brand names would be Safeguard or Panacure.
Okay.
And then another one in that class is called oxybendazole, and that's brand name is Anthelcide. So those are the dewormers that you really want to choose to start out the deworming program in young foals to target roundworms specifically. And one thing I wanted to point out about Panacure or Safeguard is that there are 2 doses on the syringe. There's a full dose, or some in the label it might say to target roundworms, and then there's an adult dose. And you want to definitely be using the full dose because roundworms, being a little hardier, they require twice the dose of fenbendazole than other parasites. So you want to make sure you're using the right dose, bendazole, again, Panacure or Safeguard, to target roundworms. If you're using Anthelcide, which is the oxybendazole, that one has 1 dose, and that will get the roundworms.
Okay. That's super helpful. Might have to put out some notes or an outline for this episode so we can catch all this information. So you mentioned making sure that the foal has the right minerals and vitamins. Does that come in the form of supplements, or is it sufficient for those to be obtained through nursing, through grain? How are we making sure that they're getting the right vitamins and nutrients and minerals?
Yeah, so that can be through a number of different ways. One would be through, well, first off, before weaning, is to make sure the dam is on a good nutrition program and that she's not deficient in any of these minerals or vitamins. And then once the foal starts eating with the dam, you'd like for the foal to have some nutrition in the form of a foal feed. So a lot of the feed companies make mare and foal feeds or foal feeds. A lot of them have growth in the name. And so those feeds are fortified. And then once they're weaned, again, there's a few different ways of supplementing. One is through complete feed. A lot of the big nutrition companies provide complete feeds that have all of the vitamin mineral requirements. In particular, if you're using one that's made for foals that has growth in the name or junior in the name. And then, so those are complete feeds. They have to eat enough of that feed, though, to get the right amount of vitamins and minerals. Then there are supplementary pellets that are meant to supplement a diet. So you're feeding less quantity, but they have a higher concentration of these vitamin and minerals. A lot of these would be some full growth type feeds. A third way would be to do it through ration balancers. A lot of the companies now make ration balancers, and ration balancers are fortified with macrominerals, microminerals, vitamins, and protein. And they're meant to be fed in small quantities, like 1 to 2 pounds per 1,000-pound horse. So not very much, because they're very concentrated. They also have a high protein concentration, typically in the 20s to 30 range percentage wise. So they're meant as a supplement. And again, you're only feeding a small amount to the horse, and those will provide ample vitamins and minerals. And the last way to do it is if you're feeding a hay-based diet with, let's say, oats, okay, a kind of traditional show horse diet from the past, where they were feeding, let's say, alfalfa and oats. So to that, you can add a vitamin mineral specific supplement where you're adding, an ounce of really concentrated vitamins and minerals. So a lot of different ways of doing it, depending on what the base of the diet is. Nowadays, a lot of people feed alfalfa, some grass hay, and then a pellet. And the pellet will have, all the vitamins and minerals, assuming you're feeding the correct amount. So you want to make sure you're following the label. I would encourage owners to talk to nutritionists that the companies are associated with, because they can explain all of this to them in great detail. So if you work with nutritionist, veterinarian, and get a solid diet for your program, there's no one size fits all. As you know, everybody's got their own favorite feed company, favorite type of diet, but there are a number of ways of doing it.
Okay. Super helpful. We talked a little bit about vaccines and the importance of those. Can you just give us a consolidated view of the vaccines that we should give, and maybe at what ages? I guess when we're referring specifically to those weanlings, yearlings, the ones that are at risk, what vaccines, what ages, how often?
You bet. So I'm going to focus here on these respiratory ones. This is not an all-inclusive vaccine protocol. So I'm not including things like tetanus, West Nile, which are really important, but specifically targeting the respiratory protection will be an influenza vaccine and then a herpes vaccine, herpes 1-4, and usually those are combined together. And you want to start those at 4 months of age. And then we give a booster that's critical a month later. And then a third one when the foal's about 9 or 10 months of age. And that third one's important because the immunity wanes. And each booster that's given makes the immune system stronger. But by the time the weanlings are showing, you'd like them to have at least the first two in the series, the primary one and then a booster. Again, usually we start those at 4 months of age, and then again about 4 weeks later. Now, I should mention that the broodmare should be vaccinated for these as well. About 4 to 6 weeks before her due date, we vaccinate the broodmare for flu and rhino. And then that will protect the foal until it's about 4 months of age through the mare's colostrum. So what happens is you vaccinate the mare in late pregnancy, and then the last 2 or 3 weeks of pregnancy, she's making antibodies, which are a really important part of the immune system, and putting those into her colostrum. Colostrum is that first milk that the foal nurses, that's critical, vital for the foal survival. And as part of that colostrum, the foal gets all these antibodies that are going to help protect it against West Nile virus, tetanus, and flu and rhino, assuming the mare was vaccinated. And that gets them to about 4 months of age. And then again, you want to start them with the flu rhino at 4 months, 5 months of age, and then again at 9 or 10 months of age. If the mare was not vaccinated, sometimes we'll start the full vaccines a little bit earlier, like at 3 months. And depending on the situation, if foals are going to be at really high risk, or if the timing isn't perfect for the futurities, you have a late baby, sometimes we'll start them at 3 months of age to get that immunity going, if that makes sense.
Mm-hmm. Mm-hmm. Yeah, thank you for pointing that out, because it's, as you know, we have the junior weanling division and the senior weanling division. And so helpful to know the timing of those vaccines for those different babies.
You bet.
So you covered this already, really, the connection between deworming and respiratory health. So can you remind me the timing of that first worming or a series of dewormings that might happen before we go to a horse show in the fall?
Yeah, so to target those roundworms, you want to deworm the foal pretty early. So that's going to be about 8 to 9 weeks of age for their first dewormer, which again should be either fenbendazole or oxybendazole.
Okay, perfect. So thinking about the horse's environment, or the mare and foal's environment, how can changes in the living environment impact respiratory health? So considering maybe their home farm, and then on the trailer, and then at a horse show? What can we do to um, kind of give the best case scenario for those areas?
Great question. So a big risk factor, once you've got that baseline health established with the diet, deworming, vaccination, a good exercise program, which others have talked about, you have a healthy foundation. Then the biggest risk factors for respiratory illness are stress and exposure, because stress, just as for people, when you get stressed and run down, you tend to get sick. And that's true for horses as well. So it's minimizing stress and it's minimizing exposure. And the third part of it is air quality and having as good ventilation as possible. So it's going to start with trailering. And trailering has been known in a number of studies to be a big risk factor for pneumonia. Some people call it shipping fever. And in that case, it's not even those viruses that I talked about. It's just the fact of being hauled long distance, and hauling long distance has been shown to dehydrate horses, to cause stress, raise their cortisol, and cortisol is immunosuppressive. And it immunosuppresses their airways, interestingly, as well. So hauling is key. And some of the important things for hauling are, one, making sure you have great ventilation in the trailer. So as much fresh air that can come through the trailer as possible. Two, making sure that urine-soaked shavings are cleaned out frequently, because the urine toxins like ammonia are really harsh on the airways, and they'll depress the airway immune system. And the airway has a little micro escalator in it that brings up particles and brings up bacteria and viruses. And hauling long distance can suppress that little escalator. And then the debris and infections stay down and can set up house in the lungs. So it's as I mentioned, good ventilation, good air quality. So making sure the bedding is clean as possible. What I tell people is to put your nose at the level of the foal's nose. And if you smell any urine, whether it's a trailer or a stall, there's too much. You got to get it cleaned out. So put your nose down at their level, and if you can smell any urine odor, then get that bedding cleaned out. And then another really important about preventative part of hauling is postural drainage, and by that I mean allowing the airways to be lowered so that they can drain out with gravity. Mm-hmm. So I mentioned that little micro escalator. If that's not functioning at maximal capacity, then lowering the horse's head for a time can really help clear the airways of anything, any particulates that they've breathed, and even bacterial agents. So what we generally recommend there is every 4 hours during hauling, ideally, you would stop and let the foal or horse lower its head. So that means untying them and maybe letting them eat and drink in a low position so that their nose is below their chest level, if that makes sense, so they can drain those airways. You want to take advantage of gravity to help clear the airways. That's very, very important. And that's been shown in research studies, actually, to help minimize the risk of pneumonia that's acquired during hauling. So again, every 4 hours, you want to stop, let the horse take a little break, let them eat and drink. Hydration is really important. And let them lower their nose down to the ground if possible, as low as possible, so that gravity can help clear the airways. And then once you're at the show ground, there are a number of things that you can do there. One is biosecurity, which we can talk more about. But biosecurity means protecting your animals from exposure to other animals on the premises. Okay, the showground is a perfect storm, right? It's getting animals from all over the country, young animals that have the highest susceptibility, young animals that are at the greatest risk for shedding these viruses and bacteria, and they're stressed. They've just been hauled. They've got a show, and so it's just a prime for respiratory disease in that setting. So once you get to the show, optimally, you would disinfect the stall before putting your horse in there. And that is particularly important if there's a series of shows back to back at the showground. If there was a show just days prior, there could be infectious agents in those stalls. And so disinfection would be a great way. And so I would encourage everybody to talk to their veterinarians about what disinfectant would be a good one to use at the show. One of them that I like, one of my favorites, is called accelerated hydrogen peroxide. So it's kind of like peroxide that you buy at the store in the bottle, but it's modified. So it's called accelerated hydrogen peroxide, or abbreviated as AHP, and there are several brands of that. And that one's really safe for the environment, safe for the horse, safe for people, and it's very broad spectrum. So you could disinfect the stall, doesn't take that long really. Disinfect it, let it dry, and if you're able to rinse, great. If you're not able to rinse, some of the disinfectants are safe, like the AHPs are safe to let dry on there. And then you can bed the stall and give time for the stall to dry before you put the horse in. Then another part of it is to keep your horses as segregated or as quarantined from other horses as possible. That means trying to minimize traffic coming into your stall area or your aisleway if possible. And I don't mean to, turn away visitors or discourage, friendship. That's a really important part of the shows. But if you have people coming, ask them not to pet the horses. Or if they really want to pet them, have a hand sanitizer there to ask them to hand sanitize. And the reason for this is if they've just handled another horse or petted another horse or foal that's shedding a virus or one of these bacteria subclinically, meaning asymptomatically, okay, just like in people, some people shed these infectious agents asymptomatically, horses can do the same. So somebody might have been handling a horse that has one of these, let's say has herpes, but is asymptomatic, has no symptoms. And then they come over and they pet your horse on the nose. That's a perfect way of transmitting. So what I'm suggesting is have them come visit, but ask them either, please, we're being really careful with the horses here. We don't want them to pick up anything. Please don't pet them. Or if it's really important for that friendship to have some interaction, ask them to use a hand sanitizer, because the alcohol hand sanitizer will kill a lot of these viruses. And then along those lines is you don't want to share supplies that are in particular around the nose or head of the horse. By that I mean nose rags. You don't want to share those with different barns or with horses that you're not familiar with. Don't let horses have nose-to-nose contact. So when you're outside the arena waiting, horses being herd animals, they want to meet the other horses. Keep your distance. Don't let them touch nose to nose, because nose to nose is a great way to transmit respiratory disease. Another thing I've seen is folks using a hose at the showground to fill water buckets, and they put the hose down in the bucket and the water comes up above it. Well, if that hose was just in the bucket of a horse that has flu or rhino, now that virus is on that hose and you're putting it in your bucket. You can still use the hose, just don't let the end of it go into the bucket. Let the water fall into the bucket, if that makes sense. So anything you could think of to minimize close contact with horses that are not part of your team is going to help protect them.
It's good. Really practical information. Thank you. Um, Anything else that you want to share about the respiratory side before we transition to the GI side?
Yeah, so respiratory side, one of the keys, as you alluded to earlier, is early detection. And that's, keenly observing the horses. And a lot of the professionals have that down, very, um, uh, to a very fine extent. And amateurs can learn from them. And that is, you'll notice the professionals, they watch their horses carefully. They're often the ones feeding them, watering them. They spend a lot of time around them. And then if something's not quite right. And, intervene early. If you sense, if your gut's telling you something's not right about this foal, have the show vet take a look at it. Definitely really strongly encourage everybody to take the temperature of their horses or foals twice a day while they're at the show. And if you pick up a fever, again, have a veterinarian look at it. We have a lot of tools that can help us to identify these infections early. One of those is we can take a nasal swab from a horse with a fever, and nowadays there's PCR panels that test for all of these agents. Two is they can do some blood screening. They could do what's called a complete blood count, or CBC, where they look at the white count inflammatory markers. There's a quick screen blood test called an SAA, that's serum amyloid A, and that's stall side. A lot of your vets can do that right then and there, next to the stall, and have a result in a short amount of time. Within 30 minutes, you'll have a result. And that can tell you, hey, there's something going on with this foal, has systemic inflammation. It might be an early marker of infection. And then if you want to get more intense in the monitoring, would be ultrasound of the chest, having your vet scan the chest. And that's something that I like to do in between the shows, before, if you're doing back-to-back shows or very close intervals, and particularly if you're hauling long distance. One pretty practical, quick way to know, is my foal handling this? We just left one futurity. We're about to haul 14 hours to another one. Is he or she up for that? A quick scan of the chest can help with that. And if there's early signs of pneumonia, then you may not want to haul that horse or that foal, because that's going to make it worse, if that makes sense. So all of these things are screens to try and catch things early. Temping the foal, any question at all, have your vet look at the foal or the show vet. Blood work, particularly this SAA, they can do it right there, right then and there, give you an idea of the health status of the horse. And then more intense monitoring, another level up, would be to do ultrasound scanning of the chest.
Okay. It's really helpful, especially right now as people are preparing and all the navigating that comes with entries and stalls and
Definitely.
travel. Yeah, great timing.
Definitely.
Okay, so transitioning to gastrointestinal illnesses, what are some common GI issues in horses, and how can they be prevented?
Yeah, so aside from respiratory illness, which is really common in young horses, GI diseases are very, very common as well. And I've worked on some show horses that got seriously ill at a horse show and had colitis, or enterocolitis, which is an inflammatory state of the bowel, and they get very, very sick from that. And one of the common clinical signs or symptoms of that is diarrhea and fever, and the horse feels crummy, doesn't want to eat well, is depressed. And I'll just call it colitis for sure. That colitis, as I mentioned, it can make the horses really ill, and can lead to fatality if it's not caught in time. And the earlier we can intervene and treat those animals, the better. So what you want to be looking for GI disease and colitis in particular, just like with the respiratory disease, long hauls predisposed to this, stress predisposed to this, stressors, not eating well. Okay, the horse is a hindgut fermenter, and their cecum and colon need roughage, need feed constantly to have a normal bacterial population back there. Everybody hears now about the microbiome in your gut, how it affects the immunity. Well, we know that applies to horses as well. And if they're not eating well, their microbial population or bacterial population that are healthy and beneficial will be disrupted. And if they get disrupted, that can allow pathogens, viruses, and bacteria to come in and cause inflammation of the bowel, diarrhea, and then the horse or foal gets really dehydrated, gets electrolyte problems, and that can have some fatality associated with it. So again, what you want to do in that scenario is catch that early. That's where the temping comes into play, twice a day temping, because horses that get these GI problems, they'll often have early fevers. Decreased appetite and quietness. If you're noticing that, again, if you have a gut, your gut's telling you something's not right with this baby, there probably is something that's not right. So, have it looked at by a vet, because the earlier that we can get to them and the earlier we treat them, A, the better outcome, and B, the less expensive it is. So, some of these tests that I'm talking about, like a complete blood count, which we would want to do in a case of GI illness, is pretty inexpensive relative to having to treat something serious down the road. Some of these animals benefit from early IV fluids. Don't hesitate. If your veterinarian's looking at this baby, and even if it doesn't have diarrhea yet, if it has a fever and the complete blood count, it is a hint for diarrhea to come. Sometimes we'll ultrasound them, just like for the chest, we'll ultrasound the abdomen, and we can see diarrhea developing in the gut. We can see inflammation in the gut lining. Sometimes early fluids will kind of nip that and stop that process from progressing. So early intervention, there's some medications we can give them early on. So again, it gets back to the same things we talked about for the respiratory illnesses, and that is early detection and biosecurity, or keeping your animals safe and to themselves at the showgrounds.
So then, when you think about what we're feeding our horses, what are some of the recommendations that you have in promoting good GI health?
Great
and
question.
Maybe not necessarily brand of feed, but types of feeds or rhythms in our feeding patterns that would promote good GI health?
Yeah, great question. There is going to be consistency. So keeping the animals on the same feed that they're used to at home is one of the best ways, because even simply changing feed can change that normal, healthy microbial population that's in the gut. And that's what we're trying to protect. So keeping them on the same diet at home is great protection. Trying to take hay, as much hay and feed with you that will last you for the entirety of the show. So you don't have to buy new hay or make a change or a different brand of feed, because we know the healthy bacteria don't like that feed change. Okay, everybody knows feed changes can lead to colic. Why is that? Well, because the bacteria aren't used to it, and then they make more gas, and that makes the horse colic. Same thing with colitis. Like to keep the feed the same, because those bacteria are used to that specific hay and feed, and so minimizing feed changes. In general, minimizing simple carbohydrates. So we know that grain, and here I'm talking about corn, oats, barley, molasses, that kind of a thing, very high simple sugars and starch, can predispose to these GI diseases. So I'm a big fan of hay-based diets, hay and alfalfa, and then a complete feed, complete pellet that all the feed companies make, as well as ration balancers. And the reason for that is the complete feeds are lower in these simple carbs and starches. And they're really, a lot of these are really good for halter horses, for example. Horses that have PSSM, for example, you're going to want to feed them a low simple carbohydrate and starch diet to begin with. So that is a healthier diet for the horse gut is a lower simple carb and starch diet. And I don't mean to imply that foals need to be on a really restricted carb diet. They don't. But what we want to avoid are these really high unnatural carbs. Just like we talk about for humans, the unnatural carbs. Wild horses, they're not eating corn oats barley with molasses, or they're not eating quarts and quarts of oats. Oats have a lot of non-structural carbohydrates in them, which are sugars and starches. So a diet that's a little more natural, again, roughage based, I'm a big fan of, and then complete feeds, and then these ration balancers. Those are the types of feeds that I like to feed that are less likely to cause disruptions in the gut.
Okay. If we have to make a food change of some kind, whether it's hay or grain, any type of change, what duration do you recommend that change occur over? How many days should we take?
Yeah, really good question. And sometimes you have no choice but
Mm-hmm.
to have to buy feed at the showgrounds. You can't physically take enough for all the horses that you're showing. If you've got a trailer load of horses, sometimes you can't take enough. So there, what I would recommend is mixing from the day you get there. Mix the new hay in with your own hay, and start out with mostly your own hay and a small fraction of the show hay, and every day add a little bit more of the show hay so that we get them accustomed gradually. In general, ideally, you would do it over 10 days, but I realize not everybody has that amount of time at a show, right? You might be back home by 10 days. So I would take however number of how many days you're going to be at the show ground. Let's say it's going to be 4, and say, okay, over this 4-day period, I'm going to, every day give a little more of the new hay or feed and a little less of my own, so that it's done as gradually as possible, if that makes sense. I hope that makes sense.
Mm-hmm. Mm-hmm. Yeah. Yeah. I mean, it makes sense that show barns with a lot of horses may not be able to haul
That's
enough
right.
hay. The Congress is a month.
That's
Full
right.
Horse Congress is a month. And,
That's right.
a lot of the world shows are a week to 2 weeks long. So
That's right. So
it's a
there,
lot of
don't
feed.
wait until you're, I'm sorry, what were you going to say?
No, just
Yeah.
affirming that's a lot of feed to haul.
A lot of feed. So
Yeah.
there, don't wait until you're out of your own hay and feed.
Mm-hmm.
Start incorporating the new hay and feed day one, small amounts, so that the horses get used to it. Horses like gradual change. They don't like acute changes.
Yeah, makes sense. In looking at GI issues, we touched on the environment for respiratory conditions. So what can we do with the environment that would help prevent GI issues?
Yeah. So some of the GI diseases are caused by pathogens and some aren't. So starting with the infectious ones or the contagious ones, those are things like Salmonella, Clostridium. There's a Clostridium difficile and Clostridium perfringens. And then there's a coronavirus that in horses causes GI disease, not respiratory disease. So some of these are agents that could be spread at a showground. So that's where that disinfection that I mentioned earlier for the respiratory prevention will come into play. If you can disinfect the stalls before putting the horse in, especially if there was a show just a few days prior to moving in, it's really helpful if you can disinfect the stall. And also that same biosecurity, which is making sure you're keeping your horses as isolated as possible. And here we're talking about agents that are spread by feces. So here you don't want to share mucking tools with other barns or other horses that are unfamiliar. So you don't want to share the shovels, the pitchforks, the manure forks, buckets, even the manure bins, because the tires could transmit things. So try to have your own equipment. And if you don't, if you have to share, disinfect them between the different barns. So if you have to borrow manure fork from the next barn over, disinfect it with that AHP or accelerated hydrogen peroxide before you use it on your horses. For example, hand hygiene, washing your hands between different barns. Again, if there's somebody that's going from one barn of one trainer's barn or one amateur's shed row to another, ask them to wash their hands. That's an easy, very important way to prevent disease transmission, both respiratory and GI. If hand washing's not handy, hand sanitizer. Okay, that 30 seconds with a hand sanitizer. Again, all this trying to cut down on transmission from horses that are shedding something asymptomatically to your horse that is young, stressed, and primed to pick up something, if that makes sense.
Mm-hmm. Yeah. So in the case of emergency, what do you recommend if we suspect that there's a GI issue happening or a potential colic situation? What are some recommendations that you have early on?
Yeah, early intervention is key. Working with a veterinarian early, walking the horse if it's colicky until the vet can arrive. Some people will use Banamine, for example, if a horse is mildly off. And if you do that, make sure you're at least in contact with the show vet so that they know, and be aware of how much you're using. Okay, these drugs, Banamine, for example, can cause harm. It can cause kidney injury. It can cause gut ulcers, and it can cause colitis if it's used in high doses for prolonged periods or even short periods in a dehydrated horse. So if you take a dehydrated horse that's already not feeling good and you're giving it Banamine, and next morning more Banamine, and next afternoon more Banamine because it's not feeling good, you're just masking the symptoms. And that Banamine could be doing harm, because if that horse or foal is dehydrated, that Banamine is going to hurt the gut and kidney, and you're going to be worse off. So I would really recommend they get a veterinarian involved as early as possible. At least be in contact, communication with them. Your own personal vet, back home, text or call, or the show vet, so that a veterinarian's involved and they can guide you in how best to handle this. And is this more serious and does it need veterinary attention, or is this something that one dose of Banamine might take care of? So I'm very cognizant and want to be practical, but just continuing to use bute or Banamine repeatedly is not the answer in a lot of these, and can do more damage than good.
So when we think about addressing some of these things or paying attention to early signs,
Mm-hmm.
what are some appropriate items for owners to have in a first aid kit to assist in this early detection, whether it's a respiratory illness or a GI illness? What kinds of things are appropriate for us to have in a first aid kit?
Yeah, good question. So number one, I would say a thermometer or a few thermometers, some hand sanitizer, some gloves, because if one of your horses develops diarrhea or respiratory signs, for example, cough, you want to wear gloves with that animal so that you're not transmitting something to your other horses. Okay. Disinfectant, as I mentioned. Again, talking with your vet about what's the best one. Again, for me, a really practical one are these AHPs, very effective and safe. And have that with you, not only to disinfect the stall, to disinfect shared equipment, but also if one of your horses does get sick, you can put a foot bath in front of the stall. And by that, I mean a bucket, with wide rimmed bucket with the disinfectant in there. And then everybody who goes into that stall dips their footwear in the disinfectant. Again, trying to cut down on transmitting something from that horse to the other horses. So disinfectant, gloves I mentioned, extra attire like coveralls that you can change if one of your horses does get sick, that you have easy access to another set of clothes that you can change before you mess with the other animals, if that makes sense.
Mm-hmm.
Again, working with your vet ahead of time, you might have some Banamine, with you at the show, but really, I really strongly encourage close communication with your vet. Have a plan, how much am I going to give? What settings am I going to give the Banamine and for how long? Have a plan in place with your vet so that you're using it cautiously, because like I say, we see at UC Davis, we see a lot of horses that are actually sick from butyrbandamine because they've had it when they were dehydrated, they've had it for prolonged periods or high doses, or they're just really sensitive to the butyrbandamine. Just like some humans can't take ibuprofen, for example, they're really sensitive. There are horses like that are really sensitive.
So, specifically a thermometer. It's kind of a random question,
Yeah.
but wanted to find out what kind of thermometer do you recommend?
Yeah, that's a really good question. A digital human thermometer works really well for horses, and you can take a horse's temperature from the rectum using one of these digital thermometers.
The last that I heard was that at UC Davis, a lot of horses are coming to you and they are sick because of bute or banamine and being administered those drugs when they're dehydrated.
Mm.
So yeah, we caught all of that.
Yeah, and then you were asked about the thermometer type.
Yes. So recommendations on a thermometer. I feel like I need to go buy several now that I've heard the advice on taking the temp of my horse just as a way to stay on top of things. So
Yeah,
digital,
digital.
what kind of thermometer? Okay.
Yeah, digital that are meant for oral,
Uh-huh.
temperatures in humans. Those work great to take a rectal temperature in a horse. Very
Okay.
safe. Just some lubricant on, like a KY lube or something along those lines, and those work really well to get a rectal temperature. You
Okay.
bet. And really important along those lines is know what's normal for your horse.
Mm,
So take the
interesting.
temperature at home and know what is normal so that you might recognize an early fever, because everybody knows 103, 104, that's a fever. But early detection might be 101.5. If your horse is normally 99.9, 101 is not normal for that horse.
Mm-hmm.
So you're going to catch it early. We'd like to catch the fevers when they're 101 rather than 104. And that's
Okay.
going to
That's
tell us
good.
there's something not right with the horse, early on. I should say, don't take it right out of the trailer, because horses are going to have higher body temperature coming off the trailer, but let them settle in, let them relax, let them, have their meal, and then take it once they're quiet. And keep track, if you record it, you'll see what the trends are. Twice a day, as a minimum once a day. Some people can't do it twice a day. There's too much going on. At least once a day, check the temperature and write it down so that you can see, okay, this horse started out 999, 999, then he was 100.3, 100.6. It's creeping up, and you'd like to catch it at that stage rather than when they're at the 104 stage.
It's good. Good wisdom. So, kind of transitioning to general wisdom from you, are there any new products, tests, or medications on the horizon that are encouraging to you regarding treating either GI illness, respiratory illness, or things that we would commonly incur while we're traveling and showing?
Yeah, good question. On the respiratory side, there are new vaccine types being worked on, which are hopefully going to be more effective, and vaccines that hopefully will protect pathogens that we don't have vaccines for. For example, talking about respiratory illness in foals, Rhodococcus equi, that a lot of people are familiar with. There are people working on vaccines, so that's really exciting there. Immunomodulators. Okay, there are some immune stimulants now that I would encourage everybody to talk to their veterinarians about. Where does this fit in with my program, and when should we give these immune stimulants, and should we give them? But there are some of those that are being worked on. A couple currently available. On the GI side, pathogen detection. We're looking at trying to detect more pathogens and earlier and with more accuracy. So that's kind of exciting. So we can pick up these infections earlier and more of them. Because right now we don't have tests for all the different types of colitis that I mentioned, but there are tests that are being developed for that. And then another one is an exciting area is the area of probiotics. You haven't heard me mention those because there are a lot of probiotics on the market for horses, but very little research to back them up. And what research is out there is controversial and not real crystal clear. Do they help? Do they harm? Are they neutral? And so we need a lot more advancement in the area of probiotics for horses. So that's an exciting area up and coming as well.
I feel like it's similar in people, the prebiotic,
Absolutely.
probiotic situation. A lot of information, not a lot of consistency.
Exactly.
But kind of a category that's encouraging, thinking that we could influence and support the gut of the horse, knowing that that's such a vital part of not only the body, but the challenges that we incur. So
absolutely. Yeah. Absolutely. Yeah. It's such a complicated physiology that the probiotics and prebiotics that we have are really scratching the surface. And it's going to take a lot more work to figure out what is it that's beneficial and what do they need. Mm-hmm. Absolutely. Just like for people, as you mentioned.
Yeah. Anything else you want to share with our audience as we wrap up?
I just wish everybody a successful and healthy season. I hope some of this will be helpful to somebody out there, and we'll work to reduce illness in our beloved horses.
Well, thank you. I know it was most certainly helpful to people. Great timing. Thank you so much. Thanks for helping us get better at what we do and get better at caring for our beloved horses. And to our listeners, I concur. Best of luck to you this fall as you head out on the road to the fall futurities. So thank you.
Thank you very much. Hope to see you there.
Yes, agreed.
Hey, if you're an amateur or a professional willing to share your story or bring content that helps us with our halter horses, you can email me at fitforhalter@gmail.com.